Hi, my name is Tobon, and I want to tell you that I'm obsessed with making sure that every child and adolescent can live a healthy and happy life, especially as they go through school. I'm a medical doctor by training and the founder of Welbin, a startup that supports educational communities to understand and improve the condition for children's well-being based on evidence. In this video, I would like to recall a time in my life where I struggled with my mental health and how that led me to create the Welbin Index Tool. It was 2007, and I had just gotten out of high school and enrolled in medical school. One day, I found myself laying in bed, surrounded by a surgical kit, and about to make cuts in my forearm with a new and shiny scalpel, asking myself if my life was worth living. And I understand how that Daniel of 2007 felt. I can still hear the name calling, the sounds and comments made by my peers in high school when I dared to raise my hand in class or just to go to the front to present something. At that time, I couldn't dare to speak in front of many people like I'm doing now. I didn't have the best grades, and I had very few dreams because all I had in my mind was the dream to make all of that suffering stop. Fortunately, this question came with a realization that I was not in high school anymore, and that I actually felt safe in my university environment. I literally decided to clean my hands, seek help, and find my meaning and purpose surrounded by my friends. However, the question of why my life was suffering never stopped visiting me. It visited me again in 2011 when I proposed an intervention to the UN about comprehensive child health. I mentioned Santiago, a 12-year-old adolescent who ended up in a hospital due to anorexia. He had lost 15 kilograms, around 30 pounds, in just 6 months without anyone noticing. So I kept on working with the dream to ensure that Santiago, every child and adolescent and young person, could live a healthy and happy life as they go through school. However, the problem is that we don't even know the number of schools that have access to water in the region of Latin America and the Caribbean. And if we don't have access to that information on basic services in schools like water, then what can we expect in terms of conditions and practices to promote mental health, peaceful coexistence, gender equality, among other things? This is why I created Welbin, an initiative that was born between 2019 and 2020 to support and help educational communities understand and improve the conditions for well-being in their schools, including good practices and red flags. This initiative is dedicated to all who dream of a school centered on children's well-being. Our main project has been the Welbin Index, a tool created by me and some colleagues to assess school conditions for well-being at scale. This tool is a self-assessment tool the school principals take in consultation with representatives of the school community that delivers quick reports and recommendations. It takes a whole school approach and is based on the global standards of health promoting schools. I would like to share some findings from our implementation in Colombia in 2022. These schools are located in rural and urban areas. They are public and private and serve over 1 million students from more than 350 municipalities. Over 35,000 of these students are migrants. This technology allows schools to receive their assessment in less than an hour on average, so we can reach many more schools rapidly, regardless of their location or their ability to pay. And we have found that on average, these schools meet around 50% of recommended practices to promote the health and well-being of their communities. Rural and public schools score systematically lower than private and urban schools, meaning that interventions need to be really based on the specific realities of each schools. Additionally, we found that approximately 8 out of 10 schools don't feel that they're appropriately supporting the social, mental, and physical needs of their students. And this is a call for all of us to really do more and better to support those schools with practical and easy tools. However, discussing policies, environment, services, and partnerships does not sufficiently speak to the everyday needs of school communities. So we created a set of thematic indicators that address specific conditions for well-being that we know are a source of concern for many schools. Mental and emotional health, peaceful coexistence and inclusion, sexuality and gender equality, nutrition and healthy lifestyle, and physical integrity and security. While schools are doing important and great work in trying to create safe and psychosocial school environments, they have a long way to go to incorporate these practices into their official policies and guidelines, curriculum, and partnerships with other organizations and services. This is important because children do not go to school just to learn math and language. Many families take their kids to school and expect them to be safe, happy, and protected. Children should have the opportunity to socialize, dream, and acquire the needed skills to make those dreams come true. We don't achieve that with a narrow perspective in education, only measured by standardized tests. With that data from 2022 in Colombia, we saw that while the number one priority of schools on well-being was mental health, only 40% had trained their teachers on social and emotional skills. And only 16% of those schools had concrete mechanisms to identify mental health problems and cases and refer them for appropriate care. The same situation presented and persisted in the case of peaceful coexistence and inclusion. While 96% of participant schools had protocols to deal with violence and coexistence situations in school, only 19% had concrete mechanisms to identify cases of violence and refer them for appropriate care. And in terms of physical integrity and security, we saw that 62% of schools have formal partnerships with external actors, protection actors. This is great. However, 43% are located in areas where drugs are being sold, psychoactive substances, and only 26% are providing trainings to prevent gender-based violence. I am sure all of us hearing this can think of one child or adolescent we want to protect, to whom we want to make that promise that they will be safe and happy when they go to school. And I want all of us to think for 1 second that every day that goes by is a day that that child or adolescent that is special to you has to go to school without that explicit promise. Working to fulfill this promise is worth it. It's worth millions of lives. And although we will fail many times, making that promise will bring us closer to making it a reality. That's why I invite you to go to this QR code to say, I want healthy, safe, and protective schools. We will continue to advocate for you and hopefully partner with you to ensure all schools are centered on well-being. This is not only free, but also our shared responsibility to do. Thank you so much for being a part of this dream.